Hi everyone, welcome to Ostomy Care with Angel Face Amy. If you or a loved one has a urostomy, a surgical opening that diverts urine from your bladder to a pouch on your abdomen, you know how life-changing it can be. But leaks, they can be frustrating and disrupt your day or night. Today in this video, we'll cover how to prevent leaks, prepare for them at night, and manage hairy skin around your stoma for a better pouch adhesion. Remember, I'm not a doctor. This is general info based on expert sources like the United Ostomy Association and also my experience as a certified ostomy nurse. Always chat with your healthcare team for personalized advice. Now let's dive in. First up, preventing those pesky leaks. Leaks happen when urine escapes around the stoma, often due to poor fit or skin issues. Because urine is such a thin liquid, not the same thing as stool, it makes leaks more common. Here's how to minimize these leaks. Choose the right pouch size. So here is an example of a little model I have here of a pouch. And if I take off the bag, this is a 2-piece, you'll see that there is less than 1/8 of an inch of skin showing around the stoma. So that is going to, it's important to measure your stoma regularly. This is an example of a stoma measuring guide. I have one of these here. So you're just going to want to hold this up over your stoma. You want to do that once in a while, especially in the beginning. You need to make sure, but the stoma size can change over time. And you want to use a pouch that with an opening that fits snugly, no more than 1/8 of an inch larger than your stoma. A well-fitted skin barrier is key to a good seal. Next, you're going to want to prep your skin properly. Clean the area around your stoma with warm water. Don't use any wipes or soap because a lot of that stuff has aloe and fragrances in it, and that can leave a residue on your skin, hindering the adhesion. Next, you want to make sure you dry it completely because moisture is the enemy of adhesion. If needed, you can use stoma powder and a skin prep. So this is stoma powder and a skin prep pad. It's just an example, but there's lots of different brands. But you only want to use this if you actually have skin irritation around your stoma. If your skin is intact and you don't have any issues, you don't need to use this. Next, you want to secure your pouch. For everyday wear, try an ostomy wrap or support garment. So this is an example of a stealth belt. So you can see right here, it has like an opening. And then your pouch can go inside it, and then it's Velcro. It's like a neoprene material. It kind of just goes around your stomach, and it gives you a little support to hold it against your stomach so that your bag is not kind of flopping around, kind of holds it. Another thing that you can use is you can see on this bag here, there's some tabs. These tabs are designed for ostomy belt, which like this is a Hollister bag. So Hollister makes a belt that clips into these clips. Almost all the brands make a belt, and that just gives you a little bit more security. This keep it snug and in place, especially during activities or sports. And you can also add elastic barriers around the edges, like around the taped border. You could add some of these barrier extenders, they're called, and they just go along the edge to give you a little more support to hold it against your skin. But this is where the most important part of the whole seal is, and you need to have this part good in order to prevent leaks. Next tip is that you want to empty the bag regularly. You want to make sure if the bag gets to be about half full, you're going to want to go and empty it because this will reduce pressure and prevent pulling on the seal. If you're active, test different outfits and pouches during movement to spot potential issues early. With these steps, you can reduce leaks significantly. Okay, now let's talk about nighttime when leaks can really ruin your sleep. Your kidneys don't stop working while you rest, so preparation is crucial. You should use a nighttime drainage system, which connects to your urostomy pouch. So they make a connector that goes onto the end. You would leave the pouch open in the open position, and you would connect it to it's the same thing that we use for Foley catheters. It's a nighttime drainage bag. So the tubing would connect here, and then it would go into a big nighttime drainage bag that usually holds about 2,000 milliliters. So that way you don't have to worry about getting up in the middle of the night and emptying it. So you would connect it to the larger bedside bag, and then this lets the urine flow freely without filling your pouch. You're going to want to hang it below bed level for gravity flow and secure the tubing to avoid kinks. I always recommend that you empty the pouch before you go to bed. So right before you go to bed, just empty it, make sure it's all good. And then a lot of people say to avoid drinking too much later in the evening, but I think it's best to use a nighttime drainage bag because I don't want to recommend drinking less because I don't want people to get dehydrated. So next, have backups ready. So keep spare pouches, maybe those water wipes I recommended, or a change of clothes by your bed. If a leak happens, stay calm. You can clean up quickly and change the pouch and get back to sleep. Also, you might want to consider sleeping on a waterproof pad. They make disposable ones like what is commonly used in the hospital, or they also make washable bed pads. This makes for quick cleanup. You don't have to change all the sheets if a leak does happen. So I definitely think you should move around and wear your pouch during the day to make sure you have a good seal. Like probably don't change your pouch. Actually, maybe a lot of people do change it right before bed, but you just want to make sure that you test your setup during the day and make sure you don't have any leaks, and that way you can sleep without worry. So next thing, I just had a question about this, so I thought I would touch on this. Some, especially men, they have very hairy stomachs, and this can hinder the adhesion of the appliance because if the hair gets underneath here, it doesn't allow a good seal, and it can cause problems. So this can lead to leaks and irritation, and so I wanted to just go over how to handle that. You can trim the hair around the stoma regularly. You can shave or trim the hair about once a week using an electric shaver or trimming scissors. Avoid straight razors to prevent nicks. You don't want to cause cuts or sores, which can get infected in this area. So you want to do this away from the stoma to keep the hairs out. So as you're trimming, you just want to make sure it falls down so that way you don't get the hairs all over the stoma. So that's one thing that you can do. We recommend that you just use an electric razor to trim or get rid of the hair so that way it doesn't hinder adhesion. You can use like the stoma powder or a barrier wipe after you shave the hair away if you need to, if your skin gets a little bit irritated. But you don't want to use this all the time because you don't want it to get all built up and cause more issues. So this simple step improves the seal and reduces skin issues. Your pouch will thank you. So prevent leaks with proper fit and security. Prep for night with drainage systems and empty it before bed, and manage hairy skin by trimming regularly and safely. These tips can make urostomy life smoother, but everyone's different. Work with your ostomy nurse for the best results. If you found this video helpful, hit the like button, subscribe for more health tips, and drop your experiences in the comments below. Links to resources are available in the description. Thanks for watching. Stay empowered and leak-free. See you next time.